As a result of fluoridation, our children will be healthier and happier.
There is no health hazard that justifies postponing water fluoridation.
You're not dealing with a benign substance.
There's much too much risk for too little benefit.
Fluoride is safe.
They decided far too early, before the science was properly in, that fluoridation was a good thing.
The dental community has no idea of the toxicology behind fluoride.
Fluoride does not just affect the teeth.
Fluoride is a neurotoxin.
This is being drank by so many people throughout the U.S. every day.
But who's responsible? Who's the doctor making sure we're not getting too much?
The weight of evidence actually is more in the favor of fluoride doing damage than against.
This is against all principles of modern pharmacology. It's really obsolete.
Water fluoridation is the practice of adding fluoride compounds to the public water supplies for the purpose of reducing tooth decay. The policy, which began in the United States in the 1940s, has been hailed by the Oral Health Division of the United States Centers for Disease Control as one of the top 10 public health achievements of the 20th century. However, a growing body of science indicates that fluoridation is neither safe nor effective. In this video, we examine why over 2,000 health, scientific, medical, dental, and environmental professionals are calling for an end to fluoridation worldwide.
Water fluoridation is the dispensing of a drug.
This is a way of delivering a medicine.
Fluoride is a drug, is a medicine.
Fluoride is being put in specifically to alter you physically, to make a physical change in you.
This is not chlorine. This is not any number of the other chemicals that are used to treat the water, make the water safe and drinkable.
It's not like chlorine used to make the water supply safe and kill the bugs in the water supply.
This is the only thing anywhere in the world that gets added to the municipal drinking waters to actually treat the human, to treat the body.
There is absolutely no drug on the market that's given in a one-dose-fits-all situation.
It's absolutely obsolete. It's in modern pharmacology, it's so clear that even if you have a fixed dose of a drug, the individuals respond very differently to one and the same dose. Now in this case, you have it in the water and people are drinking different amounts of water, so you have huge variations in the consumption.
You can have an athlete, a laborer, who are drinking many, many times the amount of water. You can have someone who's diabetic, who's drinking a ton of water compared to the average.
I mean, the whole name of the game in pharmacology is to deliver the right dose to the right person at the right time. And that's not what fluoridation does. It can't do it.
I would prefer an individual use approach. I would have no problem with a doctor or dentist prescribing fluoride for a patient that he was keeping in touch with and monitoring for possible side effects and for the efficacy of the drug. That's essentially what's done with any other drug, and that's the way it should be done for fluoride. We don't put other things in the water to try to keep everybody's blood pressure down or everybody's stroke risk down, and there's no reason why we should be trying a one-size-fits-all approach for this either.
The problem with adding medicine to water is an obvious one of consent, that people can't give their informed consent, which is a basic of medical ethics.
We're allowing communities to do to everybody in the community what an individual doctor cannot do to an individual patient, and that is prescribe medication regardless of the informed consent of the patient.
What physician that you know in his right mind would treat somebody whose medical history he doesn't know, who he's never met, with a substance that's meant to do change in their bodies, and just with the advice, have as much or as little of it as you like, but you'll take it for a lifetime because it's meant to help somebody else's teeth?
Voters medicate each other whether they want it or not. And if 51% of the voters say, we're going to medicate everybody in town, and they all get medicated.
Fluoride is not an essential element.
There's not a bodily requirement for fluoride.
Fluoride is not an essential nutrient, certainly as far as the UK goes. You look it up in the books to see what our Department of Health says, and they say that no essential use has been found for fluoride in the human body. So it is not in the category of a vitamin, and apart from anything, it's miles more toxic than any other vitamins.
Whatever benefit there is from fluoride on teeth is topical rather than systemic.
It's been shown that it's really a topical effect principally rather than a systemic effect.
It's effective topically, not when it's swallowed.
There's no reason for people be exposing themselves, all their internal organs, to fluoride when, if it works, you can do something topically.
If you want to prevent sunburn, you don't drink suntan lotion, you put it on your skin. And so if you want to have the benefits of fluoride in oral health, what you do is put it on the surface of the tooth and not drink it.
The quality of evidence for topical fluoride is in a different league from the evidence on water fluoridation. I mean, absolutely no question about that.
Adding fluoride to toothpaste, you are going to ingest some of it, and that needs to be taken seriously. But it's not made to be ingested, and it's made to be rubbed onto the surface of the tooth, which is where you're supposed to have it. It's a much smarter way to go about using fluoride in dentistry.
It's widely accepted that the topical application of fluoride to the surface of teeth is beneficial. I have no dispute with that. However, I can see absolutely no justification for asking the whole population to take it systemically, to swallow it, internalise it, for that benefit, because it's available in toothpastes, it's available in dental treatments at the dentist. So I don't think you can justify the fluoridation of drinking water on the lines of a topical treatment to teeth. It's illogical.
One of the recommendations I've made is because we now know that it doesn't need to be swallowed, that the public has to be informed. Again, informed consent. They should be told that it doesn't work by swallowing it.
One of the things that the proponents are very careful to stay away from is to mention how many people don't fluoridate.
Most of the Western world does not fluoridate their water. We are definitely in the minority in the fact that we push water fluoridation.
Many of the countries in the world, the developed countries, no longer fluoridate, never did fluoridate.
Most European countries do not fluoridate. Austria, Belgium, the Netherlands, France, Germany, Sweden, Norway, Denmark, Iceland, Italy, Greece, Portugal. The overwhelming number of countries in the world do not fluoridate, and guess what? Their teeth are just as good, if not better, than ours.
One of the most striking things, I suppose, was to look at trends in tooth decay over time in various countries.
The comparisons between fluoridated countries like America and unfluoridated ones like most of Europe, and indeed most of the world, are very interesting.
If you look at the World Health Organization database for 12-year-olds, that tooth decay has been coming down as rapidly in these non-fluoridated European countries as it's been coming down in the United States and other fluoridated communities.
Areas that don't fluoridate have seen the same decrease in tooth decay that we have seen over the same time span.
If you ask someone to pick out the lines, the decline lines, which are in countries where water is fluoridated, from those in countries where it isn't fluoridated, actually you can't pick them out. So I found that very surprising against the background of, as I say, having been a default fluoridationist.